Everyone has anxiety. Anxiety is a normal biological response to perceived threat, but our body's way of protecting us from danger can sometimes backfire and interfere or impair our daily lives. Hi, I'm Dr. Pamela Wiegartz, psychologist and associate director of ambulatory psychology at Brigham and Women's Hospital. And these are Mass General Brigham's answers to your most asked questions on anxiety disorders and CBT. Is there more than one type of anxiety disorder? There are actually several types of anxiety disorders, including generalized anxiety, panic disorder, specific phobias, and social anxiety disorder. I like to explain generalized anxiety as future-oriented, what-if thinking, with worries about a number of life areas and fear of catastrophic future outcomes. Whereas with panic disorder, someone will have unexpected and repeated episodes of intense fear accompanied by physical symptoms like racing heart or shortness of breath, and perhaps sweating. In phobias, certain situations or objects like elevators, airplanes, snakes, or even simple medical procedures can cause strong fear and avoidance. And finally, social anxiety is when fear arises from everyday social interactions or performance situations, resulting in anxiety, fear of embarrassment, or negative evaluation by others. The reason they're all grouped together as anxiety disorders is because they share a lot of common features, like excessive fear and behavioral avoidance. How do you treat anxiety disorders? One of the gold standard treatments for anxiety is CBT. CBT is a form of psychotherapy based on the idea that our thoughts and behaviors impact how we feel. With these strategies, we can learn how to cope better and manage anxiety more effectively. Anxiety is a protective response when we need it, so we're not trying to eradicate anxiety here. We're just trying to figure out how to manage it more effectively and to keep it in that range where anxiety is actually useful and helpful and not interfering with life. How does CBT work? CBT is different from traditional talk therapy. It's collaborative, time-limited, and structured. You and your therapist are working together to identify patterns in your thoughts and your behaviors that are contributing to anxiety. From there, you can develop skills to change these problematic patterns. For example, you'll learn to identify cognitive errors, like all or nothing thinking. This is where someone sees events as either good or bad, perfect or awful, with no shades of gray in between. Through the work that's done in CBT, patients can learn techniques and strategies to adopt a more balanced view of situations and watch carefully for behaviors, like avoidance, that keep us stuck. CBT can be extremely beneficial in breaking the anxiety cycle. Does CBT work? Only about 1/3 of adults with anxiety disorders seek treatment, and that's unfortunate because the research really supports the effectiveness of CBT. Many studies have shown that CBT improves symptoms of anxiety and has lasting positive effects on everyday functioning and quality of life. We all experience anxiety, especially in stressful times, but with effective treatments like CBT, we can learn how to respond differently, manage symptoms, and keep anxiety from interfering with the things that are important to us. I'm Dr. Pamela Wiegartz, and for more mental health videos, click here, and don't forget to subscribe here.